Good afternoon, ladies and gentlemen. My name is Jana Hrstkova. I am the president of Harvard Club, Czech Republic. And I'm also founder and CEO of Keller Williams, Czech Republic. Keller Williams is a technology company focusing on real estate. And it's a great pleasure to be partner of this exciting event. We are here in Prague, but today we also have international guests from Israel, from Tel Aviv. Harvard Club has been a partner of a number of events, and one successful one was last year, where we were having a great event focusing on Israel Innovation and Startup Nation. It was a huge success. So of course, when I had a great talk with Daniel about a week ago, saying how we can contribute to all these webinars and sharing information and great ideas, Daniel, in his great fashion, said, Jana, how about organize a webinar? And I said, sure. So we put together a very interesting list of people, speaker, guests, and I'm very happy that we could be partner of this event today. First of all, I would like to say that this is a webinar via Zoom, but at the same time, we are live on Facebook of Keller Williams, as well as Israel Embassy. And we have a number of very interesting guests on our Zoom from Harvard Club, from CHISL, from academia, from startups, from incubators. So I'm sure there will be some interesting discussion later on. Because we are together from different locations, I would like everybody to be mute at this moment. And if you have any question during the webinar, please type us and we'll share this information with the rest of people. So I would like, first of all, thank you, Daniel Meron, His Excellency Ambassador of Israel to Czech Republic. And I would really appreciate a few introductory remarks for this event.
Thank you very much, Jana Hrstkova. Dobre odpoledne, shalom. It's a great pleasure to be here with you this afternoon and talking from my house to all of you here in Prague and outside of Prague. It's a great pleasure to work together with Jana Hrstkova, who is a driving force, not only herself, but also through the Harvard alumni and Keller Williams to bring together this webinar. I would like to say that we are very lucky to have here with us today a really great speaker, Yoav Fisher from HealthIL is the person to talk to us about the combination between technology, science, innovation, and COVID-19. In general, if I can just make as an opening remark, a few words about Israel, Czech Republic, these days here. Israel and the Czech Republic have taken early on tough measures against COVID-19. Both countries have taken very strict measures, and both countries are one of the first countries in this area, in Europe, in the Middle East, to start opening up their economies. Now, the cooperation between the countries is very important in finding ways to fight the virus. Now, we have cooperation between Israel and Czech Republic, between Israeli scientists and experts in technology and Czech ones also. We are afraid that the coronavirus is here to stay for quite a while. Don't be too blasé about it. There could be a second wave. It will be here with us for some time, and we need to deepen our cooperation. And what Israel has to offer is digital tools and technology and experience that we have done in the last 2 months in ways to find solutions for the coronavirus pandemic. Now, there's a great work being done also in the Czech Republic through scientists working in Charles University, in ČVUT, in Brno, in Masaryk University, in different institutes here. And we also have startups here working on solutions for the COVID-19 like we have in Israel. But this combination that Yoav will tell you about is something that you might want to copy here in the Czech Republic. Just to sum up, I want to say that Yoav in Israel is also open through his platform called HealthIL to hear ideas and solutions from Czech Republic and include them in what he is doing in Israel. So I just wanted to say that there's a great opportunity for deepening our cooperation between our countries, between our experts, and I want to thank you again for joining us this afternoon.
Daniel, thank you so much for these wonderful words. We really appreciate. And I would like to invite our distinguished speaker, Yoav Fisher, to share his views. We are very lucky to have him today because he's a great expert not only in health, but also in startup ideas. So we would like to give him the floor and welcome him to our webinar. So the floor is yours.
Hello, everybody. Raise your hand if you can hear me okay. Excellent. Okay. So what I'm going to do before I share my screen, the point of this is to kind of talk about digital health and what's going on here in Israel before dealing with the coronavirus, during which we're now, and maybe what will happen in the future. My hope is to give you kind of a different perspective on it. So if you will, I'm going to share my screen with all of you and let's get started, okay? Okay, so first a little bit about myself. I currently work at HealthIL. I'll explain that in a second. Before this, I worked in venture in one of the Israeli venture capital funds that invests in the world of healthcare. Prior to that, I was a consultant to the startup ecosystem, both to investors and to startups. My focus is on business and finance, and I have my master's in economics, which I did here in Tel Aviv, which is also where I live. And very soon you will see that I'm horrible in graphic design, so I apologize beforehand. But hopefully this will be okay. So I'll begin talking about what is HealthIL. I'll talk about digital health a little bit, and then we'll move on and talk about digital health with regards to the coronavirus. And at the end, we have time for Q&A, so I'm looking forward to that as well. So first, HealthIL itself is kind of difficult to explain, and it's a little difficult to comprehend. HealthIL is a digital health ecosystem here in Israel. I work, along with my team, with all of the healthcare stakeholders in Israel, meaning hospitals, HMOs, and corporations who are stakeholders in healthcare. And we lead them on a formalized, challenge-centric, and holistic approach to understanding their needs and challenges, as well as understanding how they work. And then finally, we match those challenges to the most appropriate solution, AKA startups. So on the one hand, I have all the health organizations and corporates. And on the other hand, I have the startups and tech solutions, right? It's not always a solution to startup. Because we're a nonprofit and because we're funded by governmental entities, so we have friends from the governmental side that we work with a lot, Ministry of Health, the Innovation Authority, Digital Israel, etc. But we also work with the rest of the ecosystem also. Now, what's important about what we do and makes this whole thing unique, which is kind of the basis of everything I'm going to tell you, is that HealthIL is semi-governmental. So effectively, we're objective. We don't get money from investors. We don't get money from investing in startups. I don't send along startups that I get a cut of, nothing. This creates kind of a circle of, I guess, truth, which is critical for what we do. Because we work intimately with everyone in the ecosystem, our ability to integrate solutions into healthcare only works if we can figure out what's reality as compared to what's being marketed out. So the real and the point of this whole story is that the startup is the end of the process. We don't market them out. We don't get a cut of anything, we understand first and foremost what the healthcare stakeholders need and why, and only then do we find the best possible solutions. Right now, during Corona, we're doing the exact same thing, except we're focused only on the unique challenges that health organizations are facing in dealing with the virus. So why are we doing this? HealthIL sees digitization as a tool for fostering healthcare innovation, not just in Israel, but also globally. And there's a major gap between talking about the future of healthcare and actually trying to implement changes. There's enough organizations in Israel that put in money or introduce startups or do ad hoc meetings. We focus on the opposite. We're focused strictly on trying to implement changes into healthcare. But first, what about, what's all this interest about digital health? I'm assuming everyone here should be familiar with this, so this will probably not be that interesting, but I'll go through it quickly. And I know that there's a lot of activity in the Czech Republic concerning healthcare innovation, especially now with coronavirus. But the interest in digital health actually was peaking before this virus came along. The virus just made it that much more pronounced. And really, if I look at it, the answer is basically economic. So first, on the one hand, there's this massive global imbalance between the demand for healthcare services and the supply of healthcare services, and it's only getting worse. And this is true in every country. Secondly, there's a lot of cash, right? Huge global marketplace, lots of money. The healthcare expenditure per capita, I gave the United States as the example, but if you look at the Czech Republic or Germany or every other country, it is going up across the world. So finally, if I put these two things together, right, I see that there's interest from the practitioners of healthcare, providers and patients, insurance, and there's also the money behind it. So everyone is looking for these scalable solutions that have potential to be scaled into global solutions. Briefly about Israel. Israel has some really unique factors that contribute to the digital health ecosystem here and also globally. First, there's a lot of technical strength regarding the core competencies behind digital health, machine learning, deep learning. I personally hate the word AI, but that's what I'm talking about. But also sensors, predictive analytics, big data, computer vision, et cetera, et cetera, et cetera. Secondly, Israel has a history of technological innovation, and there's a critical density of technological talent here. So a lot of former founders from various other areas, fintech, ag tech, cyber, are moving into healthcare, again, because they see a lot of money and interest. And they're bringing with them all their technical experience. But what is really unique about Israel is the infrastructure. There's a lot of governmental support. There's governmental funding, non-dilutive. There's 80 accelerators, 9 government-backed incubators just for health. There's 30 years of digitized health records. And there's health organizations here in Israel who are willing to open their doors and try out and share integration. And in addition, I have over 40 MNCs, multinational corporations in healthcare, here with offices on the ground, each with their own innovation officer. And then on top of that, lots of money, lots of VCs pouring in a lot of money. I think from the last statistic I heard, there's more VC money per startup here than anywhere else in the world. This is both good and bad. But together, this creates this huge wave of healthcare innovation that's been occurring the last 4 years or so, 5 years. But all this sounds great, but there's always a but. And this is where I really want to highlight some new things for you. If I look at digital health from a venture perspective and healthcare innovation, there's 3 things that I think are really critical for success. Everyone wants to improve health, but it's also important to at least not harm workflow and also to at least not harm the economics of healthcare. So here in Israel, and I don't know about the Czech Republic, but here in Israel, everyone's looking to improve health, right? That's a given. But improving workflows and improving healthcare economics are totally different matters, right? Every country is really different. Every country has different practices, different procedures. Even if it is still medicine is medicine is medicine, there's different workflows and there are different economics within each country. Even from one hospital to the next hospital, they can have different best practices. And then on top of that, there's policy, right? Which we know is different in every single country. So I want to show you this from a different perspective based on how we actually work, right? As I said, HealthIL works regarding the challenges. And what we see over the last 2 years of operation, that we've cataloged over 1,000 significant challenges, some bigger, some small. And recently we did this initial study where we compared these challenges in our database to all the startups in Israel, also in our database. And we started off, we grouped all of the challenges into categories. And then we matched them to see the number of challenges within each category, the number of actual healthcare organizations who said this is a need also of ours. This number we're matching to the number of startups in Israel who can address each category. This is what I get. It's kind of hard to explain, but effectively, this is a simple supply-demand ratio. On the left side of the screen, there are challenges that are effectively oversupplied, meaning there's a lot of healthcare organizations who say they have this need, but there's an even larger amount of number of startups who are giving solutions to address these challenges. The exact opposite is on the right. On the right, there's challenges where a lot of healthcare organizations are interested in finding solutions, but numerically, there's just simply not enough startups in Israel who are offering solutions, right? So you can see that in addition to issues regarding workflows and processes and healthcare economics, there's also a mismatch between what the startups in Israel are building and the actual needs of healthcare organizations, right? This is kind of just so you can see it blown up. The most oversupplied ones relate to monitoring, indoor navigation, decision support tools, parking optimization, surprisingly, is a major issue in all hospitals, and HR management. So these are challenges where there's actually quite a lot of startups offering solutions, as opposed to the undersupplied, where there's not a lot of startups offering solutions. By the way, this assessment was made on healthcare organizations only. We work also with corporates, but we did not do an assessment for this based on corporates. My guess, if we were to do it, we'd probably find also the same discrepancies. So that was before, right? Day to day. Now we're in a whole different reality. We're dealing with Corona. And up until mid-February, that's what it was. And then we all know what happened. And as I said, today we're doing the exact same process, but specifically around the challenges of the coronavirus. So I want to look also at these challenges. So on the one hand, I have the healthcare organizations that we already work with. On the other hand, we have startups that are offering solutions, but specifically around the needs of the coronavirus. So over the last month, we worked to isolate 50 unique sub-challenges regarding dealing with the coronavirus that are in 9 major categories. This is a sample of what it looks like. The category you can see at the top, early diagnosis and detection. There's a challenge. And then these sub-challenges on the right, these are the actual nitty-gritty what the healthcare organizations want. COVID tests for a large amount of people at the same time, methods to administer assessment of coronavirus exposure risk, et cetera, et cetera, et cetera. This is public. Healthcare organizations have agreed to publicize this. And this is publicized on, we currently have 3 separate platforms that are all publicizing the same thing. Ours, there's a mirror site just in Hebrew, and then there's a mirror site on Startup Nation Central. So we get lots of submissions from startups, not just in Israel, but also from Europe, who are offering solutions for this. Now, I think this is important because these challenges that we have, these 50 unique challenges in these 9 categories, are, my guess, universal. I'm assuming that healthcare organizations in the Czech Republic, in all of Europe, in the United States, are facing probably similar needs and challenges. This is kind of what it looks like if I look at it numerically. These are the 9 categories, and you can see the amount of sub-challenges within each one. I want to take a second just to show you an example of, I'm going to blow up the operations and logistics one and show you what it looks like. This is what it looks like internally. Now, as you're reading this, I highlighted on the right as if there is a potential digital health startup solution that can address this. Now, you can kind of see where this is going. These specific corona-related challenges are also mismatched. If I look at this, a lot of these relate to equipment and supplies and hardware and access and logistics, things that I can't really find a specific startup that can address it, right? Protective equipment and clothing for medical staff, you either create it and build it or you don't. There's not necessarily a startup that I can think of that can do this, as opposed to HR management and management software, where I know there's a lot of technical solutions for it. So I'm gonna show you this in a different way. What I did here, I want to look at the most important individual challenges from a demand and supply perspective. Again, I'm going to define demand as how critical is this to the healthcare organization, meaning how many healthcare organizations stated that this is one of their needs. And supply is the actual number of startups in Israel that can address these needs. So I'm going to kind of qualitatively plot the 10 most important challenges according to the health organizations themselves. This is them. So the ones that are highlighted in green, there's quite a lot of supply of startups that can address that. Measures to remotely measure essential metrics based on corona protocols, continuous monitoring. And the ones that are in red are the ones where there's quite a lot of need from the healthcare organizations, but not a lot of solutions from the startups perspective. You can see real-time staff training on up-to-date protocols and best practices, etc. So I would estimate about 30% of the challenges facing healthcare organizations right now regarding corona have a startup that I can match to them now that's deployable. I'd say about 40% of these challenges do not have an adequate solution, which is unfortunate. Many startups are making pivots into this space. And yes, I'm also finding solutions outside of Israel from Europe. Now, you can see simple math, right? That I'm missing 3 challenges here. Those 3 are ones that simply do not relate to digital health startups. It's about the last third, right? Disinfection of common areas, equipment. This is what we were mentioning before in the previous example. Just to give you some example of startups that I'm actually looking at. So you don't have to remember what the challenges were, you can see it, but you can see that there's quite a lot that deal with this remote monitoring, TytoCare, Oxytone, BioBee, a few that deal with what was in the top left. Those 2, Virti and Panda, are actually European, and those 3 challenges that don't relate at all to startups, these are very large companies that are offering solutions. Avery Dennison, Palram, there's quite a number of these. But if I summarize this, and just kind of do this qualitatively, right? I have 800 digital health startups, all at various stages and at various amounts of quality. And there's certain key areas that we saw that are not being addressed. And we also know that workflow, process, and healthcare economics are a problem, right? But now, during Corona, I'm seeing that many of the needs and challenges are actually not related to startups at all, right? At least not the ones in Israel. Some are hardware, some are equipment, some are supplies, and some are very specific to dealing with the virus. So even though there's startups that are trying to address and make a pivot into this space, arguably in 3 to 6 months, they're probably going to be irrelevant. But I'm also seeing key challenges and key needs where Israeli digital health startups can provide excellent solutions that are deployable now, right? The broad categories of telehealth and remote monitoring specifically, as we saw before. And this is exactly what we're doing. HealthIL is actively working to help foster these integrations. But what's really interesting is that behind the scenes, I'm seeing the Israeli healthcare organizations willing to try out solutions that beforehand they were unwilling to try because they were not happy with the workflows and processes. So they're relaxing some of these constraints, which is interesting. But on the other hand, when it comes to healthcare economics, it's a big question mark. A lot of the startups are willing to give pro bono services at these critical months, which is great, or at severely reduced fees, which is great. But that just means that we're delaying the economic question by 3 to 6 months. I want to make a brief pause here before we talk about the future to talk about policy. I frequently like to look at policy as kind of an indicator of what the future will be. So in Israel, like in most countries, there's a fast track for anything that's innovative that can help with diagnosis or treatment or really, improving life. Like some countries, Israel also has a policy that effectively, for better or worse, is using spyware to monitor and track citizens. Some of this is optional. There's currently a Ministry of Health app that effectively is scraping my GPS data and cross-referencing it with GPS data of those who've been infected in order to create a map. That's optional. I can opt into this or I can opt out. So the app can be removed. But there's also monitoring and tracking that is being performed without my permission. That's a whole different story. I just want to show you an example. This is the Ministry of Health one. You can see in the middle. The app cross-checks the GPS history of your mobile phone. Great. So I can opt in, but I can also opt out. What is unique about Israel is that there's a lot of policy regarding funding, specifically regarding coronavirus-related development. This relates back to what I was saying at the beginning about the unique qualities of the infrastructure. The Israeli Innovation Authority has a brand new funding option track, non-dilutive, just for startups that can help cope with coronavirus. So if I take this and I kind of mix it with everything we've done, we talked about previously, I can kind of try to estimate what is the future for digital health, at least the ecosystem in Israel at the highest level. Of course, we all know that the reality is going to be much more complex, but we can at least start to think about it. So if I go back to my Venn diagram at the beginning, right? Everyone wants to improve lives before Corona, during Corona, after Corona. I think there's going to be certain categories, specifically telehealth and remote monitoring, where workflows and processes will be easier to overcome. Again, this is because I can see the need before coronavirus, and I can see the really extensive need now during, which means that healthcare organizations are willing to relax some of the constraints regarding workflows and processes. So startups who are dealing with telehealth and remote monitoring, I think they have quite a lot of opportunities because the healthcare organizations will change their workflows and processes in order to adopt these solutions. I don't know what's going to happen with healthcare economics. I really don't. I fear it may be a bigger problem than it was beforehand. A lot of the financial constraints are being relaxed right now because of emergency use and whatnot. But at some point, there's going to be an economic reckoning. Some point or another, healthcare organizations are going to have to start looking at a P&L. At some point or another, startups are going to want revenue for all these trials that they're doing now. And in addition, there's also other players involved in healthcare economics. For example, insurance coverage for telehealth in the United States is managed at the state-by-state level. So right now in America, yes, organizations are willing to use these solutions because it's emergency mode, but there is no indication whether or not these telehealth solutions will be covered by insurance in the future. And especially because it's state to state, who knows what's going to happen. one thing I will know for sure is that there's going to be a lot of noise, both in Israel and in, I think, globally. The coronavirus has put digital health on the map more so than it was before. It has created interests from startups who have never touched healthcare. I see many startups who are hustling to build solutions right now that arguably may be irrelevant in 3 to 6 months from now, when when things flatten and become a little bit more open. Unfortunately, some startups I'm seeing are using this just to market themselves and really don't have anything to add. Investing entities, practically everyone I know, even those with no history in healthcare, are now looking for more opportunities, or they're promoting their portfolio companies over social media. And I don't know how this will play out. I'm reading tons of articles, like I'm sure you guys are, about how healthcare will change, work will change, social structures will change, et cetera, et cetera, et cetera. But given the reality of how hard it is to deal with workflows and processes in healthcare economics, I don't know how much we're going to see drastic shifts. I'm hoping that maybe now in our Q&A, some of you will have more insights than I will. So I want to open this up. I really thank you for your time and your ability to sit and listen to me talk for half an hour. And now I want to open up to you and to everyone as a discussion. And this is my email. Should anyone want to contact me, feel free to reach out. And feel free definitely for any healthcare organizations who are interested in the solutions in Israel that we know are working. I'm curating all of them anyhow, one by one. So we can bubble them up to you as well.
Excellent. Yoav, thank you very much.
Thank you.
Very interesting presentation. I was really privileged to see it before, so for me it was really interesting to hear these additional insights and comments. And I would always cherish my trip to Israel a year and a half ago, when we had the first entrepreneur trip of ladies or women entrepreneurs in Czech Republic to Tel Aviv and Jerusalem. And we could visit a number of very interesting institutions, mostly incubators and universities and enterprises. We didn't go to a hospital at that time. But what was most fascinating, we forged a lot of interesting connection. And every week I receive to my inbox email from our crowd, which is one of these driving forces behind innovation and development. And you're absolutely correct that there is a lot of funding in Israel put into corona research. And I was interesting to hear that there is this leading vaccine candidate is developed by Vax, which $12 million were invested. And of course, if you can comment or if you have any views on this topic, you touched it a little bit, but I think that as Daniel mentioned earlier, or in his very nice introductory remarks, the corona might be here for some time. And I think that people around the world are anxiously waiting for some cure.
Okay, so I'll give you what, I'm not a doctor, but I'm spending all of my days talking to doctors. So I will share with you what they think and how they see this, okay? So they see this in various stages. Vaccine is one thing. I don't think anybody is really thinking anything before 18 months. Again, there's a lot of hype on the news. I don't want to say it's fake news. It could be real, but it could also be opportunistic. It's like rumors going around saying this will be open, that'll be open, who knows? So I'm always hesitant about stuff like this. Prior to vaccine, I think every single pharma company in the world is trying to look at treatment solutions, which would be fantastic, because if there's one pill like Advil for dealing with coronavirus, that would be great, especially for the older population. It would mean that they would be able to leave. And prior to that, there's obviously herd mentality, which effectively, herd immunity, sorry, which is effectively getting as much of the population with antibodies in their system as possible, which is the last little thing, which is the actual antibody testing. I was dealing with it here. Israel recently purchased 10 million antibody tests. There's 8 million people in Israel, so you can already see kind of where they're going with this. Effectively, they're going to test every single citizen here to try to build up that herd immunity. And at the same time, they're slowly going to relax restrictions, beginning with the younger population, in order to effectively get the antibodies into our system as quickly as possible. That's kind of the general perspective, and I think that's also what's going on in the States, from what I understand. I don't know if I answered that, but that's effectively what they're trying to do.
No, it's for me always. I'm like following any news from Israel I receive, so that was very interesting to hear your comment.
I don't think this is any different than how other countries are dealing with it.
Yeah. At the same time, some of our participants are very active in writing our questions, and I would like to post or present a question from Mrs. Michala Marksova, who is a former minister. And she's asking a question. I would like to hear example of good practice of digital health in Israel.
So, what do you mean by good practice of digital health?
Examples, I guess.
Okay, examples. So one really interesting company, and I put it in the slide deck, is a company called Cytocare. Cytocare is effectively makes a little box like this, the size of this, where you can plug in various things to it, a thermometer, a stethoscope, whatnot, and it's a remote monitoring tool for GPs, for general practitioners. So effectively, it can monitor, imagine a mother who's monitoring the child, but there's also a telehealth component. So the mother can take readings of the child, and the doctor doesn't actually have to see the child. They can say, yes, this is good, this is bad, this is whatever. You can come in, you can not come in. Now, why is this interesting for Corona? Because a lot of these things are people who effectively don't need to come in. Yes, they may be symptomatic, but they're not critical. So here's a way to kind of leave them at home where they're probably safer. Another great example of this is a company called Heramed. Heramed does fetal heart rate. It's another dongle. It's about the size of my mouse, and it has sensors on the back. And the mother can put it on her stomach. This is also FDA approved and everything. And it does fetal heart rate monitor, and it can send that to the care provider. This is interesting because of two reasons. First, the mother and her unborn child do not have to come into a hospital setting, which may or may not be infected. But more than that, and especially regarding Corona, is that the nurse who's dealing with the mother can now be allocated toward the ICU. That's the real interest of this from the healthcare provider. The healthcare provider can now allocate the nurse who would see this mother, right, and take her and deal with much more critical patients. So Heramed is a really interesting example where it affects both sides, right? The mother doesn't have to come in, and also the nurse can be used for something much more critical, which is really needed right now.
Excellent.
Okay.
We have another question, Simona Beneshova, asking whether Israel exists something like telemedicine association.
I don't think Israel has a telemedicine association. There's quite a lot of players. I will say this, countries in Europe, specifically Germany, Sweden, Finland, Denmark, France, actually have a better telehealth infrastructure than Israel does. Israel has a lot of good things going for it, but telemedicine and telehealth from the infrastructure perspective, the telecommunications that needs to happen to make it work is actually better in Europe than it is in Israel. Europe started earlier. They have a better system for it. It's developing quickly here, but there's no, I wouldn't compare it to what's going on in Germany. I think Germany is doing better.
Okay. Another question from, Mrs. Benešová say thank you. Another question from Mr. Martin Ohlidal. Mr. Fisher, do you have any tips, examples, how to stimulate, encourage establishing startups focused on needed areas?
So I'm assuming, and correct me if I'm wrong, and Martin, if I'm wrong, make sure to write and correct me. I'm assuming you're talking about that mismatch where a lot of startups are building solutions that aren't necessarily needed by healthcare organizations. So what should the startup do and what should I do are two different things. The startup, and I lecture about this a lot in Israel, really needs to do their homework. They need to have conversations outside of just Israel, just like a startup in the Czech Republic needs to have conversations outside of the Czech Republic. And what I encourage all startups to do is to think of their product in the middle and to draw a map of every single stakeholder in healthcare that is going to touch this product. And then start thinking about the economic incentives to touch this product. Every single stakeholder, whether it's insurance, whether it's a doctor, whether it's a patient, whether it's a family member of the patient, every single one. And then think about the constraints economically and the incentives, and finally think about what would make this stakeholder happier. What would make them happier from an economic perspective? Is it going to be speeding up processes that makes them happier? Is it going to be reducing outlays that makes them happier? Is it going to be, I don't know what it is, but really I encourage every single startup to draw out a heat map of everyone who's going to touch them. I see a lot of hammers looking for nails, we'll put it that way, in Israel. I'm sure it's the same thing in the Czech Republic. I know it's the same thing in England. So it's just really thinking about it strategically from the beginning.
We see that you have a very interesting visitor, which I had a privilege to see yesterday.
Okay.
So again, Adam, right?
Yeah.
Welcome. And we have another. Hello. We have another question by Vladimira Josefova, who is a very successful investor into startups. One of her startup projects, Space Tip, has won several awards, and she's very active in this area. Her question is, some of the undersupplied categories like access to food, patient satisfaction, treatment of disease planning, wellness of clinical staff.
Yeah, I see.
No. Oh, you see. Okay.
This is an excellent question.
Like all these excellent questions.
No, because the answer is, it's true. Investors a lot of times have a herd mentality and invest based on what is sexy, and it also goes in waves. I don't know if you remember, maybe 4 or 5 years ago, there was 2 months where everyone was building parking apps, or cyber or ag tech or fintech. So there is the trend. There's a lot of herd mentality, especially from generalist investors. I divide out the investors into healthcare into 3. There's medical investors, those who invest in things that are strictly clinical and put an emphasis on clinical validity. There's the broader category of health investors, those who are, also willing to look at things without clinical validity, things in wellness and fitness and lifestyle. And then there's generalist investors. The generalists are the ones who tend to follow the herd and tend to follow the trends and not lead the trends. This is just my blunt opinion. And yes, Vladimir is right. There is this aspect of investing based on what is sexy, which is unfortunate because a lot of these solutions that are workflow related or process related or dealing with back office administration, they're things that actually are needed. And there's more than that. There's things that the healthcare organizations are willing to implement now. But yeah, they're not that sexy. On the other hand, I know wonderful startups in Israel that address this. But yeah, there's a sexiness issue. I agree with it 100%.
Right. Obviously, you already touched that vaccine, which she's also asking whether there will be drug or vaccine in the foreseeable future. And as you mentioned,
yeah, I mean, I said this before. I agree with the doctors. Vaccine will be 18 to 24 months at least. I think treatment could be even out within 3 months. But I think before that, you're already seeing it. The Czech Republic is loosening up more so than Israel. But the real first step is to just get everyone sick, honestly. Everyone under 50, they're just going to release it and build up herd immunity, and that's it. It's unfortunate for better or worse. And the reality of coronavirus, at least when I speak to the healthcare organizations, is twofold. First, the healthcare organizations are in it for the long haul. They're not seeing this as something short. They're seeing, as Daniel mentioned, the waves that'll go on for the next 12 to 24 months. But healthcare knows how to deal with coronavirus. It knows how to treat people. What it doesn't know how to do is to treat 1,000 at one time within one hospital. So that's the discrepancy. They're fine with dealing with this for 24 months from now, for the next 2-3 years, if they have 2, 3, 4 human beings a day. The problem is the burden of everyone happening at once. So they'll start to release people who are younger, who are largely asymptomatic, with the hope of building up herd immunity in them first.
there is another question by Linda Stusbartova asking, what are the latest trends regarding diagnostics, such as from cough or other symptoms remotely?
Cardio is a huge one, right? But cardio is always a big one. Any biomarker that deals with cardiovascular. I'm seeing really interesting trends also in respiration. Respiration is harder. Stethoscope, spirometry, I can never pronounce that word, are also big ones. And all these things, I'll just say technologically, all these things relate to sensors. So I'm seeing kind of 2 different tracks. One is the creation of new types of sensors. For example, like a sensor that can measure, and that falls into 2 things. That's the actual hardware of creating a sensor that is more sensitive and can pick up different things, or that is using existing hardware and being able to do different correlations based on what that sensor can pick up in order to show different biomarkers. Like VO2 max is very new, right? So they're all based on that same core technology of sensor technology. The overwhelming bulk, it's much easier to use an existing sensor and gather a bunch of data and do correlations to see if you can come up with a different biomarker. It's much more intensive and takes much more capital to create a brand new sensor. These are different types of companies who are doing this: Samsung, Philips, GE, whatever. But that's basically it. Anything that can be done remotely. What is really interesting, to put this all into perspective, is the things you wouldn't think about. For example, scraping Facebook messages for early detection of Alzheimer's, for example. That's also a whole new trend. Now, obviously, this is going to take time to prove, especially if you want to show clinical validity and get FDA or CE mark. But that's also another really interesting angle. The speed within which I can type messages could be an early indicator for arthritis. So I'm seeing a lot of startups who are using really unique, innovative things. The technology is already there. They're not developing new sensors. They're going the other path of thinking outside the box of what already exists and trying to make the correlations. That's, I think, a lot of really interesting stuff. I also am very skeptical about a lot of it, but it's a lot of interesting stuff in theory.
Perfect. Very, very interesting. I know that we had a time constraint, so...
we can do, I think we have time for another 5 minutes for sure.
Okay. So at this moment, I don't see any other question in the list. but perhaps Daniel may like to comment because I see his hand raising.
I'll try to challenge you with one question, if I may. So you talk about the technology and the startups trying to find solutions for the healthcare challenges, but do you find that the healthcare is, you spoke about this a bit in your graphs in the beginning, but how much are they in sync with the advancement with the startups? I mean, you spoke the telemedicine about calling in with and having natal care given in a special department when you know in advance what the child is suffering from, but is the healthcare ready to receive that child in the special system, etc.?
So this is tough, right? This is effectively what I deal with day to day, is how do you overcome these hurdles to integration? Healthcare organizations in Israel, and I know in Europe, and I know in the United States, are more and more looking for solutions, right? That's the first thing we talked about, where there's a big mismatch. Everyone's demanding healthcare services and there's not enough supply. So across the board, there's interest in trying. Now, trying is difficult. You can say, yes, I want to try, but when you think about it technologically and operationally, it's really difficult. And this is kind of the challenge. Meaning, does this need data? Does this data exist? Is it accessible? Is it relevant? Is it clean? Is it not clean? And then operationally, is there someone on the receiving end who's able, within the healthcare organization, or even within corporates, by the way, I'm seeing the same problem in corporates. Is there a is there an actual method for innovation management of bringing in external innovations? I'm seeing a lot of ad hoc meetings, which is great, but still difficulty in moving beyond that ad hoc meeting to an actual attempt at something. And the problem is not just technical, it's not just financial, sometimes it's also operational. Israeli health organizations and also the corporations who have presence here in Israel are very open. They very much are interested and want to meet these people, but there's still a very large gap between what is being spoken about and what's actually being done. My job effectively is to bridge that gap. But yes, it'll take time. It'll take time. Healthcare moves extremely slow.
Thank you very much, Yoav. And if I can say a word towards the end of this very interesting discussion, I think there's a lot to learn from this example of the way HealthIL is working and the examples that you are bringing to us today, Yoav. And I think there's a potential for cooperation between the Czech Republic and Israel in this field. I'm very pleased that Delana Mikelashova, who is the innovation officer at the Czech Embassy in Tel Aviv, is part of this discussion today, and that she will continue to discuss this with you separately, because in the future, when you are looking for the startups that have solutions, those solutions could be here in the Czech Republic, not only in Israel. So that'd be terrific if you can look also here for those solutions. I wanted to thank you, Yoav, and Naama at HealthIL for spending the time today with us. We are on the eve of the Israel Independence Day in 24 hours, and we are tonight going to be remembering the fallen soldiers, so we are going to have to cut it short because of this now. I'd like to also thank Jana, Hrstkova, the Harvard alumni, the Keller Williams, Czech Israel, the Chamber of Commerce Chisok, my assistant Lucy Fredrichova, and all the others that put this conversation here together. Thank you very much.
Thank you very much, Your Excellency, Daniel Meron, for this fantastic idea to put together. Thank you very much to our distinguished speaker. And I wish you a nice celebration of your holiday, and I look forward for another opportunity to explore collaboration and sharing innovative ideas. Thank you very much to everyone for attending this event.